Hello and welcome to this webinar from Cancer Care Parcel. I'm Jonathan Pagden. I'm a professional radio and live event presenter, but I'm here because I'm also living with cancer myself. Today we're going to explore the unique challenges teenagers face when a parent is diagnosed with cancer. If you're an adult supporting someone in this situation, you can expect some insight into recognizing signs of emotional distress, understanding when some professional help such as counselling may be necessary. There'll also be some practical strategies to help adults to give compassionate support, to foster open communication and to promote resilience in teens who find themselves navigating this difficult journey. We've called it Behind the Brave Face, supporting teens through a parent's cancer journey. And I'm delighted to welcome Tricia Feldman, who joins us from Texas to share her expertise with us. Tricia's a palliative care child life specialist at Baylor Scott and White, providing specialised support to children of seriously ill or injured adults. She's also a certified child and adolescent grief counsellor through the American Institute of Healthcare Professionals. Tricia, over to you.
Hey, so great to be with you all. I'm going to share my slides here. All right. So glad to be with you guys. Like I said, I'm in Texas, and so glad to be with you across the world. Pretty
Tricia,
amazing.
I'm terribly sorry to interrupt you, but we seem to be seeing your presenter view rather than your slides.
Oh no.
Or at
Okay.
least I am.
Let me see if I can end it and try again.
That's it. Oh, no, it's back.
It's back. Oh no. Huh, this didn't happen earlier, of course.
Of course not.
Um,
It was there for a
Usually
moment.
presenter view is
That's it.
hidden.
Yes.
Okay. Okay. All right, well, we'll just go with it. I was gonna have my notes, but
I
I'll
think that's
just
fine.
okay. So to be able to talk with you all about, I'm glad to be able to talk with you guys all about how to support children and teens when a parent has cancer. And I may use interchangeably the term children and teenagers today. Just know that I'm referring to teenagers when I do that. But just glad to be with you all today to be able to talk about how we can best support teens when a parent has cancer, because it affects an entire family, and just and we want to recognize how a whole family is impacted and how we can provide support to various members. So just to give you all a little insight into what is a child life specialist, because I'm not sure how familiar you are with the field of child life. It's a pretty small profession here in the United States. And so just wanted to share kind of a little bit about my background. First, being a child life specialist, my field of study was in child and family development, kind of with a specialization in what we call child life, which is the study of how illness and loss impacts a family system. And then had a child life internship where I was supervised by a child life specialist. I sat for a national certification exam, and I continue to maintain that certification. We're actually seeking licensure right now in the state of Texas, and so hopefully that will be just another way to kind of authorize what we do. But wanting to share that background because I think it's important to understand that this is different than a licensed professional counselor. Our role is in the hospital setting in providing this acute support to families. And there's kind of two different paths child life specialists typically take. One being a more traditional role in a pediatric hospital. And so, child life specialists working in a pediatric hospital are going to be supporting a sick child who may be there for a surgery or may have just gotten a new diagnosis to help them understand and process what's happening to them. In my non-traditional role, I work in an adult hospital, so I'm working with well children who have a seriously ill or injured adult in their life. And so a big group of families that I work with are families who are living with cancer, and so able to work with them often in how do we tell their children about their diagnosis, how do we help them understand and process this news, and help them cope in a healthy way. And so, so just to tell you kind of what that support looks like, first and foremost, we want to educate adults. Um,
Tricia, once again, I'm terribly sorry, but you seem to have got yourself muted.
oh no,
Oh,
okay,
you're back.
that's okay. I don't know what happened. All of a sudden, it said
Love
I was
Zoom.
muted.
I'm terribly sorry we interrupted.
It's okay, no worries. So we just see it really important to educate adults, to educate parents, to be that primary support for their children. In meeting with an adult, we hope to empower and equip them to go home and to talk with their children openly, to be that main source of support for their children. Something we offer that I'm not going to really talk much about today, just because want to focus on you all being able to support your families. But just so you know, a little the work that we do is I do meet with children and teenagers in our hospital, and we use kind of therapeutic tools like art and play and writing and books to help teens and children have a safe place to express their feelings, to better understand what's going on with their parent. And then we provide a lot of resources to families in terms of like grief groups or professional counseling when it's needed. And so those are kind of the three buckets that we find ourselves supporting families in. So we'll kind of move into talking to your teen about cancer. And so, when I meet with parents, a lot of times it's that, they've just been diagnosed and they come and we're sitting together and they say, how do I tell my teenager this news? I don't want to traumatize them. I'm so worried about how they're going to respond. And so we talk about what do we say? How do we begin this conversation? And I tell them there's really three pieces of information that your child needs to know. One is that you're seriously ill. They need to know the name of the disease, and then your best understanding of what's going to happen next. And so why those things are important is that, sometimes with cancer, it's caught very early. I worked with a family last week. They had a 14-year-old daughter, and she'd just been diagnosed with breast cancer. And it was so early in the cancer progression that she didn't have any physical symptoms. And so she was going to need a lumpectomy and radiation, but really their day-to-day interaction, their life hadn't changed that much at that point. But we talked about how important it was for her daughter to know that her mom had been diagnosed with cancer, to know, what was going to be next in terms of the surgery and the need for radiation. And so, because those things would be things that she would notice and would be part of her life. And so by having this kind of comprehensive discussion, it gives her that information. And so I just wrote out a little script to kind of help you all envision what would this look like? What would this sound like to tell my teen this information? And so I just put on here, we need to talk about something important. Mom has been feeling sick recently. She went to the doctor this week. The doctor did some tests, and the test told us that your mom has breast cancer. Your mom will need to have surgery followed by a treatment called chemotherapy. We don't have all the details yet, but we wanted to tell you what we know. And I think that this can be really helpful in setting the stage for more conversations in the future. And so kind of to think about too, how do you even explain what cancer is? I think for a lot of parents, they kind of think through too. It's like, well, I tell my child of cancer, how do I even tell them what cancer is doing to my body? How do we talk about it? And so we also when I sit down with parents, we talk through how to help them understand what cancer is, how it's impacting their body. Because I think for a lot of teenagers that I talk with, I find that they've heard about cancer. They kind of know it's an illness, but they don't really have an understanding of what it's doing to their loved one's body. And so I have this picture up here, which I really love because I think it's helpful in showing you giving a visual to a teen about what's happening inside the body. And most teens that I work with, they've started learning about cells in school. But you could always ask your teenager, have you started talking about cells in school? Do you understand that your body is made up of millions of cells? And so being able to help them understand that there are different cells that have different jobs all over our body to keep us healthy. And that cancer is when some of those cells stop working properly and and causes the healthy cells to not be able to do their jobs the way they should. And that the cancer cells can grow into a lump called a tumor. And so I think that this very simple, easy to understand in that you have healthy cells, you have cancer cells that are growing very fast and make it hard for the body to do its job like it should. And being able to talk about potentially how it's affecting that particular part of the body, whether it's causing pain, whether it's causing shortness of breath, whether it's causing other symptoms, but being able to use this as kind of a spring pad into being able to help explain to them how it's impacting your body specifically. So here we have just navigating the first conversations. And I kind of intentionally put an S on the end of conversations because I think it's really important to think about talking with your teen about cancer as one of many conversations that you'll have. Initially, there may be kind of multiple conversations that happen and then small updates along the way. But you want to keep that conversation going from the beginning. And so, because at the end of your cancer journey, the hope would be that this period of time has created a stronger bond, a trusting relationship, and really connected you more with your teen rather than kind of pushing you apart. And so that starts with being open and honest and creating this trusting environment. And so when you're thinking through these first conversations, like we talked about, you're going to start with the basics, information about your diagnosis and treatment plan. Um, and that will probably bring you to preparing for changes that may come up. And so thinking about changes that you may have in your appearance, so some chemotherapy causes hair loss, or it may cause a change in your energy level. And so being able to explain, that how the treatment will impact you physically, but also how the treatment may impact changes in your routine, and your ability to do things together in ways you may have to come up with, new things that you do together or new ways of kind of gathering as a family. And so being able to talk about those things openly. And I think this can also be important to think about in terms of not just the person who has cancer, but also the people who are going to be supporting that person. So maybe a spouse or, if it's, other people in the family that are going to be helping take care of the patient, how is their routine going to change too? I guess I'm thinking of situations where, a spouse is taking their husband to chemotherapy every week. And because of that, they're not going to be as available to pick up the kids from school. So maybe other people in the community are going to be helping fill in that role. And so being able to talk about just the changes, not only in the changes in both their parents' routine, I think can be really helpful to help the whole family system know kind of what's going to be changing. I think the next piece is just recognizing that we have all different personalities in terms of information that is needed or sought after. And so you may have a teen that really wants a lot of information, that has a lot of questions. And you can really allow their questions to be your guide in terms of what information they need. You also, may have a child who is more of an internal processor and may need more time and space to process on their own. And both are okay. Both, responses are okay, whether your teen, um, is wanting a lot of information or not. That it's really helpful to kind of respect where they're at, and continue just to be open, as they may need more information. And then, like we said, just continuing conversations over time, being able to be available for um, concerns as they come up. So, some special considerations to think about. The first one I wanted to mention, and I think it's really important in this kind of present day where most teenagers have a cell phone or a tablet that has access to the internet. And just this recognition that a lot of teenagers are on social media or have access to AI. And, in an instant, you can have information about anything. And while that can be really helpful, it also can be pretty confusing for teenagers because um, they can ask AI about cancer, or they can find a video on TikTok that is a person that has cancer, that maybe sounds a lot like your cancer or is the same diagnosis, but really is going to be quite different in the treatment plan or in what the doctors are telling you. And so kind of going back to wanting to have that trusting relationship with your teen, I think this is something important to address, to tell them, hey, I know it may be tempting to want to go seek out information on your own from social media, from the internet, but the internet only has so much information about my diagnosis, about what the doctors are telling me. And so if you have questions about my treatment or what's going on with me, come to me, because you are the one that's talking to the doctors. You are the one that has the specific information about your illness, and so helping them understand that, I think, can be really important. Um, and letting your teen know, hey, if you do happen to see something about cancer online, that causes you to be worried or confused, or like, come talk to me and tell me, and let's watch it together so we can talk about what you're seeing. I think also just acknowledging that there are going to be some difficult questions that come up, and I think for a lot of teens, whether they verbalize it or not, especially if they've been around or exposed to cancer, they may worry about, are you going to die? And I think it's really important that this is really an opportunity again to be honest and to continue to build trust with your teen. And so whether the answer is really positive, that you've gotten a lot of positive information about your prognosis from kind of like the family I was telling you I worked with last week, they fully expect that she will be cancer free once she goes through her surgery and her radiation. And so they were able to share that with their daughter, and to provide that reassurance to her. And then I work with other families on the other side of the spectrum where either their prognosis is really unknown, and, or, it's, they say, hey, we're going to go through treatment, we're going to see how you respond, and then we'll know more. And I think that that's really helpful, even as you process it yourself, to be able to share that with your teen, so that they can have time to process and understand, what you're being told. And so, and I think you can do that while remaining hopeful. I have a lot of parents tell me, well, I don't want to take away my child's hope, or I don't want them to start thinking that I'm going to die all the time. And I think one of the ways that I encourage parents to address this is by saying something like, you know, um, is by saying, "Hey, I'm doing everything the doctors are telling me to do. I'm going to my chemotherapy appointments. I'm following up with them as they've asked me to, and we are going to see, kind of continue to how my body responds to the medicine, and I'm going to continue to update you as we go through this process." And I think by providing them that information without providing absolutes about a recovery that may or may not happen, I think can be really helpful to them to know that they can trust whatever you're telling them. And then I think if you have been told that your prognosis is not good, or that you do have limited time, I think it is important to relay that honestly to your children, and to be able to tell them, um, that the doctors have told you there aren't any more curative treatments for your cancer. And what that means is that at some point, you will die. And I think that also, again, is important that they know, because the more time we can give teens to process, the more space we can leave to give them the opportunity to walk through this together as a family, the healthier their coping can be long term. And I think that as parents is what we want for our kids, is to cope well long term. And so even though these conversations can be really hard or feel really heavy, giving them um, that knowledge that they can walk through this hard thing with their family supporting them, is so helpful, because teens are aware when when there's information they're not being told, or when things are being kept from them. And so especially something this big, that it helps them to be able to be told the truth. Um, and so kind of thinking about supportive communication with teenagers, thinking through some things that thinking through things that we can, say to them to help foster that open communication. And so the first one kind of goes back to what we were just talking about. Avoid saying things like everything's going to be fine, especially if you know it's not, because I think that it's important that you, again, balancing that hope with realism of the doctors are doing everything they can. We're going to face this together. We'll take it one step at a time. That gives them some tangible things that they can hold on to, that they can go forward with, um, because this will be a big change for your family going through this together. And so it's important to not dismiss concerns or worries that they may have. And that's kind of what the next two address. There's just the worries that children may have or teens may have, and just the temptation we have to want to protect them, or just to like not think about how they may be dealing with it. And so by saying things like, it makes sense to feel worried, you don't have to be strong all the time, however you feel is okay, that it creates this openness, this connection between you and them, that you can talk about what you are experiencing or feeling, that they can talk about that with you, and know that it's okay to do so. And then I think the last one I'll just touch on is, it says, I'm fine. And I think it's really tempting, again, this perspective as a parent wanting to protect your children. But teens, again, they have really good radar for when someone is not being honest with them. And so if they can tell that you're not fine, they can see you're going through cancer, you're going through a lot, that just to respond, I'm fine, feels misleading. And so by being able to say, I'm feeling a lot too, but I'm handling it, I'm getting the help that I need, we can support each other, that those kind of statements, can help them know that it's okay not to be okay, that this is a big thing that's happening in your family. It may feel stressful, but that together, you can get through this. So now kind of moving into, typical responses that teenagers may have when a loved one is diagnosed with cancer. Um, and this is true, these concerns can start really early on, all the way from, young children through teenage years. And so that's why I think it's kind of interesting to see, as I work with children and teenagers, to see how these concerns kind of cross that big span of time. Um, and the first is just, can I catch this? And I think, it starts from early childhood, that we talk with children and teens so much about, washing their hands and, covering their mouth when they cough, that they worry a lot about illnesses being contagious. And so I think that reassurance that cancer isn't contagious can be helpful, because teenagers, I talk with teenagers who even worry that it's something that they could get, something that they could catch from being around their parent. And so that can be just a helpful reassurance that this is happening inside the body. It kind of goes back to that 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 picture I had at the beginning of talking about the healthy cells and the unhealthy cells, is that you can kind of provide that clarity to them that this is not something contagious, that it's something happening inside the body that they cannot get from being around you. Um, or they may ask teenagers may ask kind of a more refined version of this question, or is this going to happen to me? And I think teens may be more aware of the genetic component to cancer, or realizing, well, it happened to my mom and my aunt and my grandma. So is this going to happen to me? And so I think that, the best reassurance providing to a teen about this is talking about how, you know, how you're talking with your doctor, you're making sure that they're healthy, that you guys are doing the things you need to do to make sure that your teen lives a long and healthy life. Um, and then, did I cause this? I think that's another big one. And I think for teens, how I hear it most often is, well, I caused my mom a lot of stress. And so I think that caused her to get cancer. And teens just have a really like an awareness of the stress that maybe they did or didn't cause in a family. And a lot of times they can internalize that and feel like that stress is what contributed to their parents' illness. And so I think it can be really helpful to provide that reassurance that nothing you did or said, nothing anybody has done or said caused this to happen. Um and so yeah, I think that can just be a helpful reassurance to provide. And then, who will do the mom or dad things if you cannot, or if you die? And I think that this question I find often comes from this place of just kids and teens wanting to know that they're going to be safe, that they're going to be taken care of. And so I think that, like we were talking earlier about preparing them for changes in the routine, it's just knowing that their world is going to be okay if dad has to be at the hospital, or if mom isn't around like she normally is, or is too tired to do the things that she normally does because she's recovering from chemotherapy. And so I think that can be really helpful to talk through those changes, like we were talking about earlier, and help them understand who's going to take on these roles while mom or dad can't. And then I also put on here special considerations for the oldest sibling, because I think this is important to think about. I work with families who will have like a 17-year-old, a 12-year-old, and a 6-year-old, and without fail, typically, a family will tell me, "Well, my 17-year-old knows everything. My two youngest don't know anything." Or I haven't told them as much, or I talk with my 17-year-old about all the changes, but I haven't talked to my younger children. And I think it's just part of a way a lot of family dynamics kind of unfold, is that your oldest child is typically the one who, due to birth order, due to, like we said, family dynamics, just ends up being that one who is considered to be the helper, or the one that is looked to kind of help manage their younger siblings in some form or fashion. And so I think that this comes up a lot, and I think it can be really helpful to address with the oldest, or to address with the teens if you have, multiple teenagers and younger children. Because there can be a temptation for that oldest, for those teenagers, to want to take on adult responsibilities, or feel like they have to handle cancer um, like an adult, or be strong. And I think it's important to remind them that they are still a child, and that while there may be things that they can help with, that are good and right, because I think a lot of teens find a lot of purpose, and they want to be helpful. And so I think that's a good thing to encourage. But I think recognizing the stress and pressure that they can put on themselves, to protect their younger siblings, to take on way too much responsibility. And so kind of assessing that as a parent and just seeing, are there ways that I can take the load off of my teen or my oldest sibling who maybe is picking up more responsibility than they need to, or providing time for them just to go be a teenager and hang with their friends. That those can all be really important things to think through just to ensure that that our teenagers don't get forgotten and just feeling like, well, kind of like as our title says, behind the brave face. Teens sometimes can seem like they're the ones that have it together, when really they're desiring that support as well. Next, just talking about some more responses, and thinking about, having cancer, I think can bring stress into a family system. It also can bring things like anticipatory grief, and grief, in general. And grief isn't always, and I think it's something I've really learned in this role that I'm in, is that grief doesn't just come at the end of life. That grief can start way before, and it can even occur in response to non-death losses. And so, for a teenager who maybe their dad was really active, he ran marathons, he's doing, throwing them up in the air, doing all these things with them, very physical. Suddenly he has cancer and he can't do any of those things anymore. That would create a sense of grief, that maybe his body had become physically weaker due to the chemotherapy, and so he needs to sleep more. That can create its own type of loss. Even though their dad is still there, they can still talk with him. There maybe is even hope that he's going to recover and be able to do some of those things in the future. Still in the present moment, not being able to experience their dad in the same way that they always have can create a sense of loss. And I think it can be helpful to think about that and to acknowledge that that may be some of the response that your teen could be demonstrating as they process, you having cancer. And then it also comes with anticipatory grief, where it can even just be the fear of losing a parent that can kind of trigger some of those grief responses. And so anticipatory grief, it's the grief that you would think you'd see afterwards. Some of those responses happening earlier on, or happening before a loss. And so as we think about this, we have stress, anticipatory grief, all that could be occurring, in a child's mind, in a teen's mind. And so when teens are coping or processing these things, it's not a surprise to see some changes in their behavior or changes in, their emotions. And so I think it can be helpful, um, to um, to know some things that are typical responses to stress and grief. So then we can talk about what's kind of not as typical or could be a red flag. And so some of the typical things you could see could be something like, anything from like changes in their sleep to having trouble concentrating in school to, maybe even being more anxious about other people's health. So not even just anxious about their parent who has cancer, but maybe now they're anxious about their other parents' health or their grandparents' health, or they're worried about their own self. And so um, those can be like typical responses to stress, or even physical complaints like headaches or stomach aches. Grief and stress can kind of cause our emotions to feel like a physical ache at times. And so those are things that you could that could typically occur when a teen is processing through these things. I think what isn't as um, isn't as typical is what we call red flag behaviors, and these are the big personality changes. These are the risk taking behaviors that sometimes a teen, might engage in. Um, these are they went from being talkative, inquisitive, doing really well in school to wanting to be alone in their room at all the time by themselves. That those start to be red flags to tell us, hey, maybe they need counseling support. Maybe they need more support than they're getting. And that's okay. It can be helpful to seek that out for them and to help them have, some supports that they can talk with to process all that they're, experiencing. I did want to make one mention about suicidal ideation. That if at any point your teen ever was to express any sort of suicidal ideation, that it's important to take that very seriously, and to seek out help immediately for them. It's really, when you have all this going on, it can feel like, oh, they're just saying that, or they don't really mean it. But the reality is, we don't know, and it's always best to take it as a serious thing, and to make sure either you take them to the emergency. In the States, we would take them right to the emergency room, and so I'd imagine you would do something similar of taking them to emergency services to have them evaluated. But I think it's really important just to mention that as a big red flag if that was ever to come up, or you were to hear about your teen expressing that. Um, and And then, so just to think about some places too, in terms of, thinking about teens' responses, is that school can be a really big one. I talked about school earlier, just of having trouble concentrating in school, or not being as engaged, can often be a response to stress or to grief. And so I think using that community support of, engaging your child's teachers or their school counselor can really be helpful in making sure that they have that support during the school day. So whether they're having a really hard day, having trouble concentrating, knowing they have a place they can go to process, or to be able to talk about what they're experiencing, or even just to have a minute to like take a breath outside of the classroom, that can be really helpful to know, that your child's school is on board and knows what's happening. It also can be really helpful in the reverse as well, that they can be monitoring for some of those changes in behaviors or red flags. Because I think for a lot of families that I work with, kind of home is the place they'll hold everything together, and they kind of do the things that they need to do, and then at home, and then at school, it really is where some of that struggle comes out, or those behaviors or those emotions are expressed. And so having that open line of communication between you and your child's teacher or school, I think, can be really helpful in making sure that that they're getting all the support that they need. Um, so kind of getting toward the end here, thinking about some key takeaways, just to recap, that want to start with open and honesty. And this is so important because, again, we want to have that trusting relationship, that when you get to the other side of cancer, you really hope that your relationship with your teen has only grown stronger. And it starts by being open and honest with them about what's happening. Kind of continues by acknowledging and validating their emotions, and so recognizing that cancer in your family is going to be something that may be hard for them, or may cause stress or grief for them, and they need that space to process. They need to know it's okay to process. Create a safe space for questions, knowing it's okay to ask hard things, or to talk through whatever they need to know about your illness to be able to cope with it. Staying alert to red flags and stress signals, leaning on your community, and using available resources. And so, taking all of those things together, and just knowing that um, that you can create the space for your teen to feel safe to process what's going on, and to be a really strong family system. And so, love to take some questions if you have them. And yeah, thank you guys so much for letting me share.
Tricia, thank you so much. There's a lot of very good sense in the last few minutes. Do make a note of that email address while it's there, but the all the links will be on the cancercare.com website as well. Tricia, we have a few people asking. First off, Helwan says, my daughter is very panicked and she does look on the internet all the time, not
Yeah.
sure what to do. I'm sure this is not a unique situation.
No, not at all. Yeah, and I think I feel like this happens so often because the internet is just at all of our fingertips, and teens, have their phones, or their way of looking things up. And so I think it's just really important to just talk with your teen about what they're reading. And so saying, "Hey, can you bring to me what you're reading about cancer or whatever video you watch. Let's watch it together. Let's read it together. And then you get to be that person to say, hey, actually, that's not true of my diagnosis, or hey, this is true, but this is what the doctor has told me about it. And so I think that that can be really a helpful way of addressing the misconceptions, or just validating what they're reading and telling you kind of what your doctors are telling you about your treatment. Because I think for a lot of teens, they just don't recognize that cancer is kind of this wide umbrella term to describe such a variety of different types of cancers, different parts of the body, different treatments, and all of that is different for individual people. Even you think about the genetic testing, they go all the way to our genetics to help best know how to treat an illness, and so it's going to be individualized for each person. And so I think that can be helpful to talk with your teen about, so they can know that whatever they're reading or seeing, is likely not true in your case, or if it is, there may be things that your doctor is telling you that would be really helpful for them to know.
Is it worth using the journalistic principle of verification? Let's see if we
Yes.
can find somebody else saying the same thing. Or is this website we're
Definitely.
looking at the only place where you'll find this particular information?
I think that's great. Yes, I think checking your sources, I think I see this on social media often, where there is like a post and it has a quote or something, and you will find that that person actually never said that quote, that actually someone just made it up and put a picture on the internet. And so I think it's a great principle to, before you believe, to encourage your team and yourself too, because I'm sure you all may be reading things about cancer too, but to try to go verify whatever sources are out there before you just take it and believe that that's true.
And connected with that, but with the information going in the other direction, how
Yeah.
do you handle when your teenager wants to share more on social media than you want them to?
Yes, yeah. I think this can come up too, just because I think teens cope so much in today's world by posting videos or posting updates to social media, or even just sharing with their friends more than you may be comfortable with. And so I think having, again, this is why that open dialogue can be so helpful, to help them understand whatever your worry or fear is about having it shared online, even if it's just as simple as privacy. I have my I want to, this is not something I want to share with everyone. And so talking through what you're okay with them sharing, what you're not, if there's certain friends that they could share with, if it's not everyone that just follows them on social media, but maybe you're okay with them sharing with a couple close friends, just because that is a way teens process, is through talking with friends and peers. And so maybe trying to find a way that you can meet them in that need to process with their peers and with others, or but also recognizing it's okay to set boundaries around what you want shared about your own health. And so being able um, to just have an open discussion about what's okay and what's not.
And it's quite possible, isn't it, that the teenager that you share a house with doesn't want to even share a room with you.
Yes.
If they don't want to talk at all about anything, how do you deal with that? What do you do? Do you just leave them to that?
Yeah, I think that that is actually probably one of the hardest situations when I talk to parents, and they tell me, well, my teen just doesn't want to talk at all. And what do we say, or what do we do? How do we handle this scenario when they just don't seem to want any information? And I will, I'll tell parents that I think it still is helpful to, so that they know you have cancer, that they know this is going on. But then if they're not asking a lot of questions, one way to try to engage them would be to kind of answer questions you've had for them, just assuming that maybe it's something that they would think, like, one of the, you could say something like, the doctor told me I'm going to have to go see him 3 times a week. It was one of the questions I had was, how often do I have to be at the hospital? And so kind of making it your own question, but saying, this is something I asked or wanted to know, and this is what they told me. So I think that can be a helpful way to try to engage them, to see if that prompts any kind of conversation. But if you have a child that just doesn't seem to want a lot of information, I think just saying, hey, I'm not gonna. if you don't want updates, then I'm not going to necessarily update you every day or every week about my diagnosis. But when something important does, when I'm told something important or something I feel like you need to know, then I'm going to tell you, even if you're not asking, because it's really important that you still have this information. And so I think there is a place to just respect. Maybe they don't want to talk a lot about it or don't have questions, but still, as the parent, there may be times where you just have to say, we're going to have to talk about this, even if you don't have a lot to say back to me, just because it's important that they be informed and know.
Hmm. My own children are considerably older than teenagers now, but
Yeah,
I had this problem exactly a year ago when I was diagnosed, about letting them see that I don't really know what's going to happen and that I'm
yeah,
scared as well. How
yeah,
valuable is it to sort of share that, to be vulnerable to your own children, to see that to let them see that you don't have all the answers?
yeah. I think that can be really helpful in that in that kind of, I think back to, in the presentation, it's tempting to just want to be like, "Oh, I'm fine. I'm okay." When in the reality is like it's a lot for anyone to be told they have cancer, to go through cancer treatment. And so I think for teens especially, they can tell when, like they're not, most teens, I would say the majority are not oblivious to when their parent is stressed or having a hard time with something. And so I think by allowing yourself to be vulnerable, to say, I don't know what's going to happen. I'm doing what the doctors are telling me, but we really don't know what the outcome is going to be. That can feel hard, but it creates this connection between you and your children that I think can be really valuable. I think you can also couple that with recognizing your teen isn't going to be your emotional support person, that you need to have your own person or people you're processing with, whether that's a spouse or a family member, friend, counselor. And even being able to share that with your teen of, I have worries about this sometimes too. And, I've gotten a counselor who I'm able to talk through those worries with. And it's been really helpful to me that by kind of modeling the ways that you're coping with the stress and challenge of your illness, I think can be really helpful and freeing for your teen to know, okay, it's okay if I need someone to process with this too, or I have questions about it. Because kids look to their parents to know how to cope with hard things. And so I think even as teenagers, they're kind of looking at you of how do we get through this? And so I think parents can be helpful to their teens in that way too.
I can see a teen having a reaction just to the word counsellor,
Mm.
the word
Ah, yes.
counselling, and
Yeah.
indeed even to the very word cancer,
Yes.
that you
Yes.
have to be careful about mentioning it for the first time. So it might be valuable then for your teen to see that, I'm going to a counsellor.
Yeah.
Maybe it'll help if you did too.
Yes, I think that can be a great way to initiate that conversation. I think that it can be helpful for them to see counseling as just like another support in terms of the family. I think sometimes teens view counseling as like a punishment, like, oh, I have to go to counseling because I've done something wrong or because something is bad, and it's like, no, this is just another support in our world. And so I think for families that are having a really hard time, like a teen's having a hard time coping, it can be so helpful to know that their parents also going to counseling, because it makes it okay. It's like, okay, well, this is something we're both doing. I also encourage parents when they're talking with their teens about counseling to ask their teen to try it at least 3 times before you guys kind of assess and make a different plan. And the reason I think it can be helpful to phrase it that way is one, because it's really easy to not to say after one time, okay, I'm done. I don't want to go again. But by the time you've gone 3 times, a lot of times, especially if it's a counselor that is a good fit and they are skilled to help your child. Typically by the third time, your teen has found some sort of value in it. They've kind of gotten in the routine of going, and it's no longer this new kind of scary, unfamiliar thing. And so a lot of teens I find will keep going after 3 times, especially if it's, like I said, that good fit of a counselor. Um, if after 3 times it's not a good fit or they're not like finding help it be it to be helpful, then I think you can reevaluate, like, hey, is there another way we can get my teen support? But not just to say, okay, well, we tried and that was it. But it's say, okay, how can we reevaluate? Is there another source of support out there? Like maybe there's a teen group or a cancer organization or someone else that my teen could connect with that maybe would be more beneficial than this counselor has been. But I think that that can be a helpful way to approach it, especially encouraging them to go a few times before they just tell you they don't want to go again, to try to get their buy-in to it.
We've covered a lot of ground in the last
Yeah.
45 minutes, and a lot of it being the balance between general information and being very specific to handling your own situation.
hmm
So this may be slightly unfair, but I'm going to ask you to finish by generalizing. Is there one thing that applies to every situation, one thing that you can say that will work for everybody, whatever it is? Even it can be very, very simple, but one thing that is universal.
Yeah, that's a great question. Um, I think at the end of the day, I think for most teens, they just want to know that they're going to be okay, that their family is going to be okay. And I think as a parent, we want to provide that reassurance to our children that things are going to be okay. And so I think that, even when things are difficult or when our prognosis isn't what we hoped it would be, or or there's just a really stressful time in our illness, that, as parents, we can try to find ways to help our child to have that sense of safety and security of knowing that they're gonna continue, like, things are gonna continue, they can continue to have that routine and normalcy, as much as they can, and so, I don't know, I think as parents, we want to support and protect our children as much as we can, and so by being, being that reassuring presence for them of knowing it's okay to not be okay, I guess, can be helpful.
And that, I think, is the perfect place to leave it. Thank you, everybody, for your attention the last 45 minutes. Thanks to Tricia for giving us the benefit of her experience and expertise. We hope the presentation has been of use. We hope you'll join us again. If you want to follow these thoughts further, you'll find links to Tricia's work and several places suggested by her that may be of use at our website, counselcareparcel.com. That's the end of the session. Thank you, everybody, for joining us.
Thank you.